as you can imagine, it is a little bit difficult for us to set the time of our webinar, because the attendants are from all over the world. And in fact, we have the colleague from Malaysia that has just wrote us his greetings, but then we have really people from South America, and checking the list of the person from Europe, of course, from Portugal, from UK, from Hungary, from Brazil, and so on. So Spain, Slovenia, and so on. So thank you for having accepted our invitation. I hope that you can hear me correctly, because I have two computers today, because the webinar, I am broadcasting the webinar. I'm managing the webinar directly, as you can see behind me, directly from the demonstration room, the also operating theater of the clinic for cattle in Hannover. And as all of you know, the clinic for cattle, the Rinder Clinic, the clinic for cattle in Hannover, is one of the most famous in the world. And this year, the clinic is having its 100 years jubileum. This is the reason why I am here. Tomorrow and the day after tomorrow, there will be the jubileum meeting of this for this centenary. Around me, there is activity. Perhaps you can hear also some voices of assistants that are dealing with activities. But on the back of me, I think you can see from another camera. You can see here. I go here. Here it is written. Here worked Professor Goetz. Here worked Professor Rosenberger. So this is a clinic where two of the most famous pediatricians in the world worked. I don't know whether you can see the, yes, if you see where is the World Association for Pediatrics, you see two tables, and it is in German language. Here worked Professor Goetz from 1925, 1955, and then here worked, so here worked Gustav Rosenberger from 1953, 1978. So, and the webinar of today is really, we can consider a link, a bridge from the history of the veterinary medicine and the actuality of the pediatric. In fact, we will hear Professor Jürgen Rehage, that he will tell us something about the history of this clinic. Professor Rehage is a professor here at the clinic. Then he graduated in veterinary medicine, and then he moved also for a couple of years at the University of Vienna as a deputy rector for teaching. But then last year he came back to Hannover, and then and he will show us, tell us something about the history and the development of and the future also of this outstanding clinic. And then so we will move to the current problem, current challenge for the pediatrician, especially also here in Europe. And we have the lucky of having a very, very important, very outstanding expert for lumpy skin disease, Dr. Tsviatko Alexandrov, that is that come from the European Commission for the Control of FMD, is a fast risk management specialist. Therefore, two outstanding topics, and I don't want to let you waste time. Therefore, I would like to ask immediately Professor Rehage to start his presentation on the history of this clinic. So, Professor Rehage, the floor is yours. Thank you.
Okay, thank you, Arcangelo, for the nice introduction. But just to be precise, I returned this April, May, just for one more year. And next year I'm turning 68 and I'm going to retire. So that's the plan. So my days are really counted here at the University of Veterinary Medicine in Hannover and here at the clinic for cattle. Okay, so as you mentioned already, we just, okay. Can you see and
it's fine.
Screen? Okay. As you see that we are celebrating tomorrow with the little conference, symposium, the 100th anniversary of our clinic for cattle here in Hanover. And on this occasion, we agreed to give some insights about our history and how things turned out in recent years. Just a second. Okay, so let me start with those things which did not change over the 100 years, that are the task. And in particular, the teaching, research, and clinical services. So the major task still is, always was, and still is, the training of veterinary students, that they acquire the first day skills as required by the EVE, which is checked every 7 years, that we fulfill these minimum requirements, but also the training of veterinary experts in bovine medicine and also in obstetrics and theratogenology, and of course continuing education of those veterinarians who are already working in the field to keep them updated. And of course our teaching should be evidence-based, and in this context research is quite important to generate this evidence, and development and promotion and progress of veterinary medicine, of course, is one of the major goals. And also very important, the development of young academic veterinary talents for a future academic career, possibly. And to provide a clinical service in the clinic as far as this is necessary for teaching or research purposes. So that didn't change. That was already the task for Richard Götze when he received an appointment as a professor for obstetrics and cattle diseases in the year of 1925. And can you see the pointer? Do you see the pointer? No. Okay. I'm uncertain. There is in Zoom, it's a while ago that I used Zoom. There is a pointer somewhere, but whatever. It would be nice to have a pointer. Let me see.
Perhaps you can use the mouse.
I was using the mouse, but obviously you can't see that. Do you see?
Yeah, we can see the mouse. We can see.
Okay, so this is Richard Götze in the age of 44 years, and he was appointed in 1925. And his idea was, because at that time we had clinics organized according to disciplines, internal medicine and surgery and so on and so on. And he was a professor for obstetrics and cattle diseases, and his idea was that we need to bring all aspects for the different species together. We need clinics that are organized according to the different species. So for equine, for bovine, for companion animals, pigs and poultry and so on. And another idea was that all aspects of the different subjects can't be covered by a single professor, They are so diverse and so demanding that we need more than one professor. He was the only one at that time for cattle diseases. So a species clinic for cattle and more professor for the different subjects within the clinics. And in the end, it turned out that in 1953, the Clinic for Cattle Diseases was founded, and a second clinic for cattle, namely the Clinic for Obstetrics and Steroidonology, and a third clinic or institute at that time for domestic animal insemination, which was very on vogue at that time and was coming up, and andrology. And with Gustav Rosenberger, who was a student of Richard Goetze, and Rosalis, who came from Leipzig at that time, with the founding directors, and Richard Goetze himself took the lead in the Clinic for Obstetrics and Gynecology and Cattle. And Gustav Rosenberger worked at the clinic until 1978, and his successor was Matthias Stöber. Maybe several people still know him as a really very impressive personality. And the development at that time for the Clinic for Cattle was pretty simple. Professor Stöber was the successor of Gustav Rosenberger, and Hannah Scholz, an animal nutritionist by training, was a successor of Professor Stöber. And the same, also simple constructed, was for the Clinic for Obstetrics and Gynecology in cattle, starting with Richard Goetze. So in his heart, he felt responsible for cattle diseases. But his student, Gustav Rosenberger, took over the Clinic for Cattle Diseases. He himself headed the Clinic for Obstetrics and Steroidonology. And already in 1955, unfortunately, he passed away and was followed by Erich Ähnelt in 1956, and then in 1976 by Eva Grunert until the year of 1998. And then we had the Institute for Domestic Animal Insemination and Andrology, not only for cattle, but for all species. So now it's getting a little bit more complicated and difficult. It started with Professor Lies, followed by Hans Merkt. And Hans Merkt, to put more emphasis on the clinical aspects, the clinic, according to him, the clinic was renamed to the Clinic for Andrology and Domestic Animal Insemination. So it turned from an institute to a clinic until he retired, which was in 1993. And now an Institute for Reproductive Medicine was founded with Burkhard Meinecke for female reproductive medicine, and Ella Töpfer-Petersen for the male reproductive medicine. And after her retirement, it was renamed in an Institute for Reproductive Biology, because Burkhard Meinecke, in his feeling, he was neither a clinician nor a real medical doctor. Biology was a subject, and it should be more the basics, basic research in reproductive biology, and that was the reason it was called the Institute for Reproductive Biology. At the same time, in 1993, to cover the clinical aspects, and since in the Clinic for Andrology and Domestic Animal Insemination, not only the male fertility, but also the female fertility of all species except for the bovine species, because that here was the Clinic for Obstetrics responsible for the female fertility. But all other species, male and female, were all meanwhile covered by the Clinic for Andrology and Domestic Animal Insemination, and that was the reason to close this clinic and to distribute the experts from this clinic to the different species clinics. So for the equine clinic, for the porcine clinic, for small ruminants, for dogs and cats. And so all these people were distributed, although they were used to work closely together. And so after this experience from 1993, for a couple of years, people figured out it might be better to have one roof construction so that we are working in teaching and research more closely together, and to organize that better, they formed as an organizational roof the unit for reproductive medicine, covering all species except the bovine, because the bovine was still in the clinic for obstetrics and gynecology in cattle. So there was the development in reproductive medicine, which was also a very important subject for Richard Götze. So most people associate Richard Götze only with cattle diseases, but that's simply not true. It was cattle diseases and fertility and obstructive he really cared for, and that was the reason that he started the three different clinics and institutes respectively, and in particular for the clinic for cattle diseases and obstetrics and gynecology in cattle, so two cattle clinics. Development was simply easy, and but for the other species it got a little bit more complicated, and now we still have the unit for reproductive medicine covering the different species except bovine, but the people in reproductive medicine are still assigned to the different clinics: equine, porcine, small ruminants, dogs and cats. So, and then in 2003, we had a merger because we had these two cattle clinics, and as you know, fertility and internal medicine, in particular metabolic diseases, are really closely related. It appeared that it doesn't make any sense anymore to have two different cattle clinics competing with each other. It's better to merge these clinics to one clinic and to reorganize everything to have these synergy effects that people hope for by that. And since Heiner Bollwein at that time was also appointed as a professor coming from the Ludwig Maximilians University in Munich, and he was an expert in male reproductive medicine, that was the reason that the male reproductive medicine, andrology, and also the female biotechnology in reproductive medicine was switched and moved to the clinic for cattle from the unit for reproductive medicine, because both male fertility and biotechnology was still located in the unit for reproductive medicine. But Heiner Bollwein, as an expert for that, claimed it, and there was a reason that it was also here. So what happened since 1955 in the Clinic for Obstetrics and Cattle Diseases? Because, of course, we all discussed the organizational chart, but there was also a thematic development. And let us start with the Clinic for Cattle Diseases, starting with Gustav Rosenberger, still responsible for all subjects related to cattle. And he had also three, I think most people will know them, that is Gerrit Dirksen students who did their habilitation. So everybody who's not coming from a German-speaking country probably doesn't know what an habilitation is. That is a kind of super PhD leading to the permission to teach at university, and is not a mandatory, but still is in most cases a requirement to receive an appointment for a professorship in Germany and other German-speaking countries. It's replaced more and more by the PhD, but most people are still doing in Germany the so-called habilitation. And Gerrit Dirksen, who moved to the LMU in Munich, and Gustav Gründer to Gießen, and Matthäus Stöber, who stayed in Hannover and took over from Gustav Rosenberger and headed the Clinic for Cattle Diseases from 1978 after Gustav Rosenberger retired. And Matthäus Stöber quickly realized that again we need more heads responsible for research, and according to the subjects who really were important at that time, there was in particular metabolism and nutritive deficient diseases. There was an animal nutritionist who was hired to the Clinic for Cattle. So the Clinic for Cattle always was open also for other subjects. And that was somewhere in the early 80s. And in 88, Wolfgang Klee, guess many people still know him, he spent from 88 to 1994. Then he returned to Munich, who took over as a responsible professor the position for herd health management. And finally, after the retirement of Matthäus Stöber, Henner Scholz, the nutritionist, took over the head of the Clinic for Cattle, and decided after the herd health, as Professor Klee, as head of the herd health management, moved to Munich, that in expecting already the merger of the two clinics, that the Clinic for Cattle will not continue with the herd health management. Instead, it will be moved to the Clinic for Obstetrics and Gynecology in Cattle. And after the merger, it will be anyway part of the Clinic for Cattle again. And instead of the herd health management, a professorship was appointed Professor Klaus Doll, who then moved to Gießen, and he was responsible to surgery, in particular orthopedics and abdominal surgery. And after he returned, moved to Gießen, there was a new appointment, me at that time, but not for surgery, but for cattle diseases, covering also other aspects of bovine medicine, but especially for surgery, again, orthopedics and abdominal surgery. And the idea behind that was, for example, taking a cow with apomazal displacement. That cow is for 45 minutes, not more, a surgical patient, and before and after that, with all these metabolic disorders, apomazal reflux and ketosis and fatty liver, patient of internal medicine. So it was, again, cattle diseases, and especially, but with a focus on surgical cases, which was seen as a focus for the professorship. So for the Clinic for Obstetrics and Gynecology in Cattle, it started with Richard Götze. Unfortunately, he passed very quickly away, and was then followed by Erich Ähnelt, and he hired Joachim Hahn. I'm not sure of many, if many people of you know him, but he was really one of the first people who started with experimental biotechnology in reproductive medicine. In particular, he was really a pioneer in embryo transfer and also in vitro fertilization and so on and so on. Erich Enel was followed by Ewald Grunert, and he added a new professorship for the health of the mammary gland, and at that time was also a milk laboratory formed by Ursula Weid. And I emphasize Ursula Weid because Ursula Weid was the first female professor in 1978 or so, at the University for Veterinary Medicine in Hannover. So that was really unique. Together with Kirchhoff, she received also a professorship for bacteriology. So Ursula Weid in so far was also a pioneer at our university. And then again in 1998, Martina Hödemaker, she's still here, apologizes. Unfortunately, she's not available today. She took over the position for herd health management. Professor Frerking, who was hired in the 70s, was a student of Erich Enel. And also Karl-Heinz Lotthammer at that time, who took a position in the in Lower Saxony for herd health management of the agricultural. Peter, now you need to help me. What is the Rindergesundheitsdienst in English?
It's Cattle Health Service.
The Cattle Health Service of Lower Saxony. And Ursula Weid was also a student of Erich Enel. So he really had a perspective for future subjects. Christine Aurich was a student of Professor Hahn, moved to the veterinary school in Vienna. Jörg Aurich was a student of Erich Grunert, moved also as a couple, and are still at the veterinary school in Vienna. Wolfgang Heuwieser at the Free University to Berlin, Holm Zerbe to the LMU Munich, and Wolfgang Zaremba, so not Martin, but Wolfgang Zaremba, he ended up in industry. However, so it basically just seeing the people who filled position at other universities was a quite successful time. And now in 2003, after the two clinics were merged and andrology and biotechnology was part of the clinic for cattle, this shows the organizational chart and development of the pediatrics at the veterinary school here in Hannover since 2003. With Heiner Bollwein at that time, he followed Heiner Scholz. He was a founding director of the clinic for cattle after the merger, and a year later he retired and Heiner Bollwein took over. Martina Hödemaker, herd health management, was still there, and I was still there with cattle disease as specialty surgery, and a new professorship was founded, and Christine Wrenzicki was following the lead of Joachim Hahn with the molecular experimental reproductive medicine. Christine Wrenzicki took over. Unfortunately, both Heiner Bollwein and Christine Wrenzicki left us already a couple of years later, so spent a relatively short time, but nevertheless, the merger was successful. Then it took a while that reproductive medicine biotechnology, the position was filled again. That was can't remember exactly, somewhat 2006 or so, 2006, 7, 8, and somewhere in this period, with Csaba from Budapest, and finally my position after I moved to Vienna as a vice rector was filled, and the position was received a new denomination with Marion Schmicke for veterinary endocrinology and clinical pathology, because lab medicine appeared to be an important part for the research developments. Unfortunately, the position of Heiner Bollwein was left open, and the university didn't agree to fill that position again, but it is right now announced, and the process for a new appointment is just ongoing. And as you can see, it's not only me who is retiring next year, it's also Martina Höhlmacher 6 months earlier, and also Csaba has only 5 years to go until retirement. So there are many positions. One is already in process, but 2 positions will be announced next year or end of this year. And the position of reproductive medicine and biotechnology will be somewhere in the next years announced. Marion Schmicke still has a couple of years to go. So what I want to show with this slide is the development of publication activity since 2003. So after the merger, so 2 different, or let me just say, what I forgot to mention is, I'm not sure if everybody is aware, Gustav Rosenberger held the preliminary World Pediatrics Conference in Hannover in 1960, and on this Congress, it was agreed with other people that a new World Association for Pediatrics should be founded, and that happened in 1962 at the first World Pediatrics Congress. So Gustav Rosenberger was not the only one, but one of the founding members of the World Association for Pediatrics. And we are quite happy that we have Alexandrov as the current running president of this association is joining us today and also tomorrow, and to celebrate the 100th anniversary of the clinic. So it was not only Gustav Rosenberger who was active in international professional organizations, it was also Matthäus Stöber, and he was one of the founding members, and he really took lead and initiative to establish the European Association of Establishment of Veterinary Education, which was established in 1988. And everybody who is in Europe working at a university knows what this means, that we are evaluated every 7 years according to the standard operating procedures, which are quite tough to meet these requirements set by EVE. However, after the merger of the 2 clinics, you can see what happened in 2003. So 1 year after the World Pediatrics Congress in 2002 in Hannover. What really kept us busy, what explains also that the number of publications per year at that time was really low, with 0.5 impact points per head at the clinic, which is really low. Yeah, I'm going to finish very quickly. So, but it increased 2010 to already almost 40, and 2050 with more than 60 and 4.5 impact points here as a publication activity per head at the clinic. And one reason was that there were really effects of synergy, but also a strong commitment of all people at that time working at the clinic for research. So there was also a structural development. I go through these slides very quickly. One milestone was the completion of the new building for clinics for obstetrics and gynecology in '65. There was a lot of remodeling in 2000, in the early 2000s for biosafety reasons, because we had these communal stables which didn't work anymore, and now we have one stable, one barn, well, one stable, one box for one animal, and do not have any contact to each other to make sure. What was really important for the clinic was the establishment of a clinical laboratory by Professor Scholz and further developed by Professor Schmicke, and the establishment of a research lab with molecular technologies. The Richard Goetze House, as you can see, only the trees grew, the building did not change, and the reason, at least from the outside, the reason is that there's a Historic Preservation Act. We are not allowed to change anything, but inside electricity, equipment, technologies, IT, and so on, of course, is new. And the demonstration hall, 53 and 2005. And in this hall, which is also protected under the Historic Preservation Act, we are only allowed to change electricity, water, and so on. In this hall, Arcangelo is actually standing. And this is the original tipping table. It's still working, 100 years old, but we are using that from the Richard Goetze developed, but we are using that only for calves anymore. And prefer meanwhile the hydraulic multifunctional table. So quite of textbooks from our clinic. There are still challenges, in particular for our clinics, the structural change in agriculture. The bovines are held more regional, in particular in the northern parts of Germany, and we are located here. So travel distances to receive patients are getting longer. Farms are increasing in size, getting more professional, what means the requirements for biosecurity are growing each year. And there's a change in land use, what makes it really difficult. And also we are competing, since we are educating veterinary practitioners, we are competing with really specialized veterinary practices. In consequence, there's really a steady decline in the patient number from more than 3,000 hospitalized cases per year to about 1,000 at present. And also the patient portfolio is changing. Unfortunately, they are getting more and more complicated and demanding, and those patients we will need to teach first aid skills are getting less and less. There are different solutions, of course, the skills lab, as in every university, but that cannot replace practical teaching in animals, in real animals, in live animals. So we are using also our teaching and research farm in Rute. We are doing on-farm teaching with ambulatory service and herd health management service. But unfortunately, again, in our region here around Hannover, the number of cattle farms is decreasing every year. So we have to discuss what we are doing, what will be the next step, establishing an extension unit somewhere where cattle are kept. But this discussion is still ongoing. And of course, change is always driven by challenges. And there are a lot of challenges in research. Precision livestock farming, just as one keyword, global warming has significant impact on the occurrence of infectious diseases, which we thought are exotic and do not are not relevant for us. The changes in feed bases, for example, ruminal CO2 and methane emissions play a role. The revetting of former peat bogs to reduce methane emissions, heat stress. So there are many subjects are really important that need to be addressed. Feeding-related health problems and their interaction are getting more important, and of course, animal welfare. So next step will be reorganization. The clinic for cattle and the clinic for swine and small ungulates are going under one roof and for one organizational unit, what means different species, many different people from the two different clinics. And this is really a field which is under construction and will be subject next year. So that is what I wanted to say. 100 years of development and ongoing change, which will never stop. And that is why I'm working at the university. It's always challenging and every day a new challenge. Thank you for your attention. Thank you for giving the opportunity.
Thank you, Jürgen. Thank you. So during your presentation, I was in the meantime I was enjoying this demonstration room, demonstration hall, demonstrating room. So I moved also the other camera, as you can see. But here, everything in this room talk about cattle. And here on the back, I don't know whether somebody can see, there is the details of the exactly how to exactly examine animals, cattle. So the exact procedure of the examination is based for a veterinary clinic. So it's from Mr. Gates, and all the names that you mentioned. So I think they are known everywhere in the world. Just Rosenberger, Gates, Dixon, Stoeber. So I think that the majority of the people that have heard your presentation, they have somehow heard this name, and for sure. If we consider the number of pediatricians that have spent some time here at the clinic for cattle in Hannover, I think there are thousands of them. I don't know if they can be calculated from everywhere in the world, from South America, from the eastern countries, from Africa. There are people, pediatricians that spent sometimes here to learn how to examine and to treat cattle. So thank you, Jürgen. I think that eventually after the second speech, we can also, if somebody has some memory, I have some memory in any case. Yes, yeah, Jürgen, please.
Just one word to all those people who are working at university and feel qualified. Just as a reminder, next year there will be announcements of vacant positions.
Good. That is good to know. That is good to know. I will try again, Jürgen. I will try again to come here. So thank you. Thank you, Jürgen. So now it is time to continue and to jump from the history to the current challenges that we as pediatricians have also, not only in all over the world, but also here in Europe. So that is the lumpy skin disease. Therefore, please, now I ask Dr. Tsviatko, Alexandrov, and eventually if Tsviatko can also tell us how to correct pronounce his name, because it is not easy to pronounce. So therefore, now we jump on one of the current problem in Italy, especially in Italy, because lumpy skin in Sardinia is a big issue now. So therefore, thank you, Dr. Tsviatko. Please, the floor is yours.
Thank you very much, Arcangelo, and thanks for the opportunity and pleasure and honor to be here with you. I think you're doing really great pronouncing my name, very correct like a native one, and not many people can do that. I'm a Bulgarian veterinarian, and I worked with lumpy skin disease before during the previous epidemics in Europe, and I'm following for more than 10 years the situation. And here I will present mostly the lessons learned, what we've seen and what we know about LSD, how to control it worldwide, and particularly the experience from before and how it is addressed nowadays. So about the disease, lumpy skin disease is a disease in cattle and water buffaloes, and in Africa in some wild ruminants. Fortunately, here in Europe, for the time being, we don't have any evidence that wildlife is involved. It is the virus belongs to Capripox virus genus, same family as the virus of sheeppox and goatpox, which also plays some role with the vaccines that I will explain later about. It is characterized by fever, nodules on the skin, difficult recovery, and loss of production, and has a really substantial economic impact for the livestock industry, mainly because of loss of productions, but even more due to the trade restrictions and losses in long-term period. The difficulty with it is that it is mainly transmitted by vectors. So it's a vector-borne and transmitted by all kinds of blood-sucking insects, flies, mosquitoes, ticks, and basically what we've tested in Europe in the farms with LSD turned to have the virus in the vectors. The incubation period is after experimental inoculation between 4 to 15 days. In experimental and in field, we've seen from 1 to 5 weeks after infection by vectors. And in OWA, the World Organization for Animal Health, we have up to 28 days of incubation period. This is the maximum that is considered also for the control measures. For the clinical signs, we can see the nodules, but usually also with the nodules, we see high fever. So this is something characteristic to recognize the disease. And a combination, let's say, of nodules, and if we see something like 40.5 degrees, that can be really strong suspicion for lumpy skin disease. In large lymph nodes, depression, decrease in milk production, and also we can see some ocular nasal discharges. The nodules on the skin, they can pass through lumps, scams, scars all over the body. So it's generalized infection, but mostly we can see it on the other and genitalia. The disease severity varies between animals. 30 to 50% of inoculated cattle develop clinical disease in experimental settings. Please consider that there may be many animals that are in viremia and have subclinical manifestation. And it's a self-limiting disease with no career status. We can have severe cases passing through severe cases, through mild cases, subclinical, and animals without a really productive infection. Next one. Okay. So some pictures from the field. We may be lucky if we catch LSD at this point. So these are not so visible clinical signs with smaller nodules. And when we don't expect the disease, this is something that will be missed. And really, the timing of detection matters for the control and eradication, and the scale of the whole epidemic. And some pictures with, more visible and more severe clinical signs with the generalized nodules in different animals with the scabs, already very late infection, and virus all around in the environment and vectors. In differential diagnosis, we have many diseases and that can look similar to LSD, and we see them in Europe all around. like bovine herpes virus to insect bites, urticaria, pseudocowpox, and many others. Basically, in the current situation, we need to consider really lumpy skin disease in the differential diagnosis and test to rule out or confirm a disease. If we have a suspicion, it shows that the system is working and the awareness of farmers is high. And in differential diagnosis, very similar to lumpy skin disease is what you see here on the screen. We call it lytic response. It is caused by vaccines, live vaccines, homologous. In very few animals, well, it's nothing dangerous. And there is no problem with this. These superficial lesions, they disappear in few days. They're very superficial, not so deep like the real nodules, and then nothing happens. But something that you may consider that you may see after vaccination in very, very few cases, and there is no problem with it. So the global distribution. If we go back, it's a disease that comes from first reported in Zambia in the 20s of last century, endemic for Africa. And 2013, it jumped to Middle East, also Israel, and then basically reached Turkey, Anatolia, the Asian part, and took two directions, one to the west and one to the east. To the west, it was successfully controlled, and I'll give you exactly the example that can be really valuable for now. And this strategy is used nowadays to stop the spread. And the other direction to the east, so it crossed through whole Asia and basically reached Indonesia in 2024, threat to Australia. And we had also more outbreaks in Northern Africa, posing a threat again for Europe. And this is more updated map with the current outbreaks in Italy and France. And the general picture also with some outbreaks in the East. So this is how it went, more successfully controlled here in Europe. Basically, with the virus, most recent virus, we have two clades of the virus. So clade 1. So 1.1, this is the needling-based vaccine strain based on the vaccine that I used. Clade 1.2, it is the classical white strain that is currently circulating, as you see here on the map, also in Europe, North Africa, and clade 2. This is a recombinant strain from vaccine origin since 2017 that caused the epidemics in Asia and the east part. So it comes from bad vaccines. So we need to really be careful what vaccines we choose for our control strategies. In terms of transmission, clade 1 strains, we know that the non-vector transmission is inefficient. So there is a potential minor rule, but here mostly the vectors play a role, while in clade 2 strain, here we have more direct transmission animal to animal than clade 1. For control strategies, here in the European Union, in the animal health law, lumpy skin disease is categorized as list A disease, which is a disease that usually does not occur on the territory of the Union. And it is subject to immediate control measures and eradication. So it is important, very important disease, same as foot and mouth disease and many others. And across the world, there are different control strategies, particularly for lumpy skin. Here in Europe, we use total stamping out policy, which means culling and destruction of all affected and all contact animals. So kill all animals in the affected farm and contacts. And using vaccines, in our case, live homologous vaccines that are more expensive, that are based on lytic strain, on lumpy skin disease virus, but showed much better results than the other vaccines, the cheaper that were used in the rest of the world. Combined with movement restriction and zoning. Some countries, non-EU, in the Balkans, they did partial stamping out, meaning culling only the animals showing clinical signs, but not the other animals in the farm. And vaccination with the same live homologous vaccines combined with ozoning and restrictions. And the other part of the world, so no stamping out, using different vaccines based on the availability with some zoning and restrictions. To see how get better impression how fast the disease can spread, I bring you back to 2014. So this is Turkey, Anatolia, with the first outbreaks coming here at the border with Syria, taking the directions to the north. So the data is from the ADI system of the European Commission that are regularly reported there. And you can see, okay, we have here a peak in the summer when we have the vector activity, and the disease is moving very fast. It's in large scale. So just to get an impression how it went. There is slight decrease in the number of outbreaks during the winter time because of we don't have flying vectors at all. Turkey has started to use sheeppox vaccines based on sheeppox strain, 3 times doses of sheeppox vaccine. That in a way helped, but years later with accumulation of immunity and etc. And in 2015, in the summer, so it reached Greece. And this is the first time when Greece started emergency vaccination for lumpy skin disease. And it was the first time in the European Union with the live homologous vaccines. So you see now in August. So basically the red are the new outbreaks, the purple dots are outbreaks 30 days from the confirmation of the disease. And here in August, you see really fast spread in Greece, stopped with vaccines. And I think maybe the mistake at that time was that neither Greece, neither Bulgaria used preventive vaccination to vaccinate before the disease comes. So you see how it is. Then during the winter, there was slight stop. And we thought that the vaccine did the job in Greece, but there was area with less vaccination coverage, so less cattle vaccinated, let's say below 70% of the population. And in April 2016, there was a big jump again that threatened significantly Western Europe. So all Balkan countries were affected for very, very short time. And okay, now to your attention, how quick it can spread in areas with low and high density of cattle. So all of them, till August, the map was covered till Serbia, North Macedonia, Albania, Kosovo, and reached the borders of Romania, close to Croatia and Bosnia and Herzegovina. So that was there, the general picture of all outbreaks, and at that time all countries immediately started to vaccinate with these live homologous vaccines from South Africa. They are not available in Europe. It was a coordination between all the veterinary services of those countries, but also the farming societies and communities, reaching clearly high level of vaccines for short time. So what we understood that it is really seasonal ring disease with the vector activity. It is recognized by detection of clinical signs, which is very important. But when we detect the disease, we must be clear that we are much behind, 2-3 weeks behind. It is spreading very quick, and it is extremely difficult to control and eradicate without vaccination. And to show you how effective the vaccine is, basically a movie from EFSA. The darker blue is the highest vaccination coverage we have, above 80% of the population in that area. We start from April 2016. Going with the outbreaks, and you can see how the vaccine was proceeding and closing the outbreaks, and we had at the end very small number of outbreaks in the areas where the vaccination coverage was very low or not sufficient, let's say. And this was also the time when Croatia did preventive vaccination without having any outbreaks. Now we have the example with Switzerland that also did preventive vaccination to be safe, and later Bosnia and Herzegovina also vaccinated. So these are the vaccines that were used in Europe, live homologous. So according to the World Health, Movement band vaccine after vaccination for 28 days, no movement of cattle, then they could be moved, and it really did not reflect so much on the trade with products from cattle from the vaccinated area. There were some complications for moving live animals, but this was regulated with the WAB. So all animals are vaccinated independently of the age. So from the birth, you can put the needle, and later animals from vaccinated mothers, they were vaccinated at 3 or 4 months of age because of the maternal immunity. And the vaccination recommendation was to do it at least for 3 years. So one vaccination campaign per year in vaccination territory. The vaccination, the size of the vaccine area because of the vector, so it's recommended to be above 50 kilometers of radius. With vaccination above 80% of vaccination coverage, that is okay. And on this graph, I show that there is no problem with the milk after vaccination. Usually you have slight drop after the first vaccination, then there is no problem. In Switzerland, what I hear is that they're very happy with the vaccine they use, and it's also live homogeneous, same as the one that was used before. And just to show you about the effectiveness, basically these are the countries that were affected. So vaccinating for several years, those countries that really use stamping out, total stamping out, and live homogeneous vaccines, they perform better than the others in terms of results, less outbreaks, and faster eradication. So, high awareness and clinical surveillance are great importance to recognize the disease. Serology doesn't work, so we don't look for the disease by serological sampling and testing, but only recognizing clinical signs, and then take sample and do the PCR. Currently, the modern PCR tests, they can differentiate between the vaccine strain and the field strain, so there is no problem with that. Skin nodules are bad samples. Blood samples, they can also give information, but usually you find the virus 4 to 12 days post-infection. Saliva is excellent sample, what we realized, so then I would recommend it. Good. It's a herd infected with lumpy skin disease. You can see some cattle with visible nodules here, and all the vectors around, really to get impression about this, how difficult it may be, and also some animals with not so visible clinical signs. All these vectors, they fly between farms, and that's important that the neighboring farms are vaccinated as soon as possible. So for control, vaccination is the best tool. That's clear for everybody. Stamping out cannot do this alone. And in terms of cost, this is an example from my country, Bulgaria. Basically, 1/3 of what we spent was for vaccination, and we could do only that. This red part here is for stamping out, killing, destruction, compensation, etc. And we try to fight with the vectors and spend some millions for vector control that show to be very ineffective and doesn't work. I mean, it more harms than supports anything. So vaccinate and that's it. And these are the key messages in the conclusions. But vaccinate with a vaccine with demonstrated efficacy. That is better spend some more money for good vaccines rather than prolong the disease and the process. So mass vaccination, movement controls, culling, and safe destruction of infected animals. High enough vaccination coverage must be targeted as it is recommended by the EFSA reports. Nowadays, well, expectedly or not, we've seen again disease in Europe. So as Kanju mentioned, we have the problems in Sardinia. So not the earliest detection there. Emergency vaccination is applied. So I'm convinced that when the sufficient vaccination coverage is achieved, no more outbreaks will occur. There was a jump here in the mainland of Italy. That was a surprise, but this outbreak was very quickly traced from Sardinia with movements, and perhaps it was really early detected. and it is gradual, really, the service, because there were no outbreaks anymore there, and this is where no other place ever happened. So it shows that early detection is possible if the system works well. So no vaccination in that part. And we had also outbreaks in France. So how they went there, still we don't have clear evidence, but at the border with Switzerland, lumpy skin disease appeared with visible clinical signs and no numbers of outbreaks. Close to the border with Switzerland, Switzerland immediately performed preventive vaccination with the vaccines that were used, same as those that were used in Europe before without having the disease. And they're very happy with the results. Here, vaccination is still ongoing. We have a recent outbreak that is a little bit more to the west, and that means that the vaccination zone must be enlarged. But this is something that is expected and may happen. And the good thing is that the national vaccine banks and the European vaccine banks for lumpy skin disease are activated to successfully control this epidemic as 8 years ago. And with my last slide, here I present to your attention some materials that are available online for lumpy skin disease. Basically, you can find everything there. On the AUFMD emergency tools box, so please have a look and get more information. And I'll be around for any questions that you may have. I'll be happy to answer. And thank you very much for your attention. I hope I was not too long.
Thank you, Tsviatko. So really clear and complete description of the situation of the history, and also some idea on how to approach the disease. As mentioned, Italy in this moment is quite challenged by this problem. In Sardinia, you mentioned they started the vaccination. It's already at a good point, but to my knowledge, they haven't reached all the animals so far. We may have some time for question, and perhaps if there are some question. I have a question, Tsviatko. Is there some relationship, some correlation between the severity of the clinical findings and the epidemiological situation? I mean, in an area that is free, or on the other side, in an area where the disease is endemic, are the clinical findings milder than in an area where animals are completely naive?
Well, with the naive animals, what I know, but we've seen here mostly naive animals, is more severe. The situation is more severe. And in some animals in Bulgaria, we have had really devastating picture. I mean, very, very, very hard clinical signs. And some animals died, but the mortality was not really high. And we've seen also maybe some microphonia appeared, I don't know. And also in pregnant animals, it's not very nice. I mean, in Africa, I've seen lumpy skin disease in areas where basically we expect to be endemic, and there is vaccination, and they showed very clear clinical signs. We didn't, okay, we could see the fever, the nodules, we could see the fever. But I would say here in naive animals, it's in the European breeds, it's a little bit harder than the native breeds.
Are there as a question on this topic? Because I think that this is a disease that can anticipate as an outbreak that we will have a challenge. I mean, peste petit ruminante or Rift Valley fever and so on. Jürgen, you have a question, and also Mingaudas urbutis. So Jürgen and then Mingaudas, please.
Yeah, thank you very much for the presentation. There was one slide, the drop of milk yield after vaccination on herd level from 3,000 to 2,500, if I understood it correctly. My question is, what is the acceptance of vaccination among farmers, and do you recommend a voluntary vaccination program or a mandatory or compulsory vaccination program?
Oh, thank you very much for this question. There were many discussions before, but they were mainly for political reasons. So really moved by the politicians. On the vaccination and the side effects, farmers are happy. Farmers are happy, particularly when you have a situation of lumpy skin disease in your country or territory, or you're at risk. And they really were willing to vaccinate because they have seen that there is no other way. There was slight drop in milk that recovered very quickly after the vaccinations, and in the next years, I don't think anyone complained in Bulgaria. And the example of Switzerland is really very clear. I mean, Switzerland is really a country that the cattle industry is important, and they didn't at all think to vaccinate or not, but immediately apply the vaccination. And for the question, voluntary or not, I would say it is a must. If you have lumpy skin disease, it is a must and must be done by all farmers. And it is clear if you want to control eradicate, you must reach this coverage of at least 80% or more of the population in that area. Otherwise, something may still be burned and then the effect is different.
Thank you. Mingaudas Urbutis, and also if Mingaudas, you could be so kind to say where are you from? Thank you.
Thank you very much. I hope you're able to see me. I'm from Lithuania, from the Lithuania University of Health and Sciences Veterinary Academy. Wanted to thank for the invitation to this seminar and for the nice presentation. My question would be the case in Italy, and you said that they had a very fast detection. It was very, very early. Could you do you know maybe why it was so successful that they caught it early? What was the reason there?
Oh, I don't know. I mean, it's personal opinion because I was not involved in that. But what we know in Sardinia, it is not so early detection. I mean, this is where we have most of the outbreaks. And it took some time for the vets to recognize and sample the animals because what we've seen also from the PAF committee, from the presentations and the reports, we can see some scabs that are old lesions already. But we have only in the mainland of Italy, so it is in the internal part, far from the island. There is only one outbreak. And what I know from the data, it was traced that animals were moved from the island of Sardinia. So the field investigation showed that they were identified and tested before even showing clinical signs. So it is good to follow the reports at the webpage of the European Commission of DG Sante from the PAF committee, so you can get more information. But the fact that you have only one outbreak without more outbreaks, it means that it is early detected and it stayed there and was contained. It is really a success story that happened nowhere in the world.
Okay, thank you very much. I'll try to search for more
Yeah,
information.
Miguel, the problem, especially in Sardinia, is that there are many animals that are on pasture and are under very, very few control. Therefore, the detection was not really early in Lombardy. So where we had the outbreak on the Po plan, it was easier, but in Sardinia they had a lot of problem also in managing this. It's a different system.
Okay, good. But good that your system worked. Yeah, so that's nice. Yeah.
Yeah.
Hello, everybody. I would like to ask about the spreading of disease because you showed that this disease is present in Russia as well, yes?
It was, and nowadays I have no idea.
And you showed that it is present in Kaliningrad region. It's a part
No,
of
it
Russia,
is.
which is close to border with Poland and Lithuania. Is it true or is only
No,
the
no,
map?
no. I mean, it is the map is okay. The map is for a certain period, and it is of affected countries, so the whole country is covered. But I
Okay.
mean, it
So
is north, and usually it took this direction, the borders with Kazakhstan and
yes, okay. So I understand that this disease didn't exist so close to our borders. Yes.
no, for sure.
Okay. Thank you.
Are there some other input or some other question? Usually we don't have in our webinars, we don't have a lot of time for question because we try to keep it in the time, in a time that is useful also for practitioners, that they can stop their work for a while. So therefore, if it is so, I would just would like to thank, just to remind, I would go back to some aspect of the history of this clinic, just to remind the name, to remind, and already Jürgen has already emphasized the fact that the association, that the World Bariatric Association was practically created here. So was the idea was done here in 1960 during the first Congress for Cattle Disease. I have to move here because I finished the battery in the other computer. So, Peter, I think you hear me again, eh?
Yes, we hear you.
Yes. Okay. So, but the battery has finished. That means that I also have to finish to quit the webinar. Therefore, thank you, Dr. Tsviatko. Thank you, Jürgen, for this really historical bridge from the past to the present to the future. We have some position in Hannover for next year. Therefore, it is really a future situation. Peter, so I think you as a secretary, you have to close the webinar as it is as becoming a tradition that you close the webinar.
Yes.
Also mentioning that we have the record.
Yeah, we have recorded it as always, and you will find it tomorrow or the day after tomorrow on our YouTube channel. And thanks for participating, and thanks to the brilliant speakers.
Thank you to everybody. Bye-bye. See you to the next webinar and also to the next congresses. And tomorrow,
thank you very much. Bye-bye.
Thank you.
Bye. And tomorrow we will assure that we here in Hannover, we will enjoy the jubileum for all of us.
Thanks.
Bye-bye. Bye-bye.
Thank you, Archangel.
Thank you, Dr. Tsviatko. We keep in touch.
Bye-bye.
Thank you.
Bye-bye. We'll keep in touch. Bye-bye.
Ciao, ciao.